At Kaiser Permanente, like many other healthcare organizations today, physicians are struggling to manage increasing expectations from patients, purchasers, their own organizations, and external agencies, while still providing the best possible care. But many physicians and their staffs are finding innovative and effective ways to improve care quality by creatively managing schedules, patient panels, and specific patient populations. Their successes can serve as both practical and inspiring examples for other physicians facing the same challenges. In Kern County, Kaiser Permanente has significantly improved the management of one of its largest patient groups, those with hypertension.
We really had a disorganized system where patients were seen for their appointments and treated, but we really didn't have a way to get them back for follow-up and for a recheck of their blood pressure.
In the past, patients who needed blood pressure checks would either have to wait for an appointment with their doctor, or they could come to the nurse clinic, but the nurse would have to interrupt a doctor's scheduled appointment to review the readings, or have them return for a follow-up visit with a doctor.
The problem was the nurses were getting very discouraged with doing the hypertension because of waiting for the doctor. As well, the doctors were not the happiest either because they were being interrupted in their patient flow and getting their patients seen in a timely manner.
But a team headed by Dr. Ha came up with a simple solution that improved monitoring for hypertension patients. Today, a certain number of nurse clinic appointments are reserved each day for hypertension patients. They're booked when doctors diagnose hypertension, when patients contact the call center for a blood pressure check, or when a database reveals patients with a history of hypertension. But there are no scheduled doctor's visits and no co-payments required.
We do at least 3 blood pressures, 5 minutes apart. We take a history of what their medication is currently. We ask them how they're feeling, any headache, dizziness, increased weakness, anything new going on with them.
The nurse also provides information on diet, medications, and other issues that might concern the patient. And then, if the patient's readings are within acceptable levels, the patient is released, and the nurse gives the patient's chart to the doctor for review and follow-up instructions. It's only when pressure is elevated above a certain level that the physician is summoned.
If the systolic blood pressure is higher than 160 or the diastolic is higher than 90, then we have to get a doctor. Blood pressure's going off now. It's going to go off again in just a few minutes. I'm going to go talk to Dr. Ha.
Okay.
I'll be right back.
All right.
It's making our job easier. We're not wasting time with waiting for the doctors. We are charting, then if it's within the parameters, we give it to the doctor that day.
And the doctors have far fewer interruptions, too. But the best news is how the changes have affected the clinic's patients.
Okay. That's fine.
The overall results for us over the past year have been phenomenal. We started the year with an overall control rate of about 50%. By the end of 2005, our overall control rate for a region had gone up to 77%, which was the best control rate in the region of Southern California.
A different population-based technique is being used to help physicians manage chronic disease patients in San Diego.
So one of the big issues that we saw was that patients were falling through the cracks, that we didn't have systems in place to capture these patients and to follow these patients and make sure that they had the care that they needed.
So a new department of population-based medicine developed a special tool to help doctors keep tabs on patients with chronic diseases. First, clinic records are searched for patients with conditions such as cholesterol issues, hypertension, and diabetes. Their information is transferred to the tool, which care managers from population-based medicine present to doctors in a group meeting to get their recommendations for treatment, medications, and follow-up care. In the short meetings, each doctor deals with as many as a dozen cases at a time, rather than scheduling individual appointments for each member.
In 20 minutes, I can take care of 5 people as opposed to 1 person. So it is a tremendous boon, I think, in terms of our productivity.
Hello, good morning. This is Marta Martinez. I'm a care manager for Dr. Gallardo. May I speak to Mr.
After the meetings, care managers from population-based medicine call the patients to ask about their condition, provide care information, relay the doctor's instructions, and make any necessary appointments.
It also allows us to do some preventative care with the patient. We check, our care managers check to see if the patient is due for a mammogram, if the patient is due for a retinal exam, if the patient's had a pneumovax.
And all without creating any new work for the patient's doctor or the doctor's staff.
And the nice thing about this project is basically we're able to do more with the same staff.
So patients are happier and healthier. Most are thrilled to receive proactive calls from someone on their healthcare team. Other medical offices have found new ways to both improve quality and ease the burdens on physicians through creative use of staff and patient scheduling and pre-visit screenings.
How may I help you today?
In the past, when patients called the Chino Medical Office to request an appointment, they were often told their own doctor's schedule was full and they could see another doctor at another office. But this left patients unable to see their own physicians and physicians losing touch with their patients.
The biggest problem was it wasn't patient-friendly. That was probably the most driving factor, is we had so many patients that were angry and frustrated.
But today, medical assistants routinely sift through doctors' schedules to flag patients with appointments who might not actually need to be seen. This clears space for more necessary visits. Meanwhile, nurses triage calls from patients with immediate concerns, direct some to urgent or emergency care, handle some with simple advice over the phone, and then schedule same-day appointments for those who really do need to be seen. So patients now see their own doctors when they need to, and doctors stay in closer touch with their own patients.
I'm seeing almost exclusively my own panel of patients, which, when you know the patients that you're seeing, it makes patient care a lot easier.
But even more important, the entire staff also coordinates efforts to maximize the quality of the doctor's visit by proactively offering patients, before they come in for scheduled appointments, a wide variety of screenings or tests from 8 different quality indicators based on risk categories or past diagnoses. The procedures can include breast, cervical, and colorectal cancer screenings, blood pressure checks, and tests associated with asthma, diabetes, cholesterol issues, and coronary artery disease. This makes sure the doctor has the most up-to-date and complete information when the patient arrives, so he or she can address the patient's concerns much more productively in each encounter.
Our staff really feels empowered that they're there to take care of the patient and do whatever it needs to be done, and because of that, we all work really well as a team. MAs, nurses, physicians, physician extenders like PAs and nurse practitioners work very well together to take care of each individual patient that accesses us.
RNs and doctors, we usually have the gap in between us, but with open access, since we talk a lot, we communicate about what the patient needs, it's everything is level pretty much. It's nice, I like it.
The satisfying nature of the teamwork shows in other ways too. For example, call-offs or sick days are down significantly for both staff and doctors. And best of all, patient satisfaction scores are rising steadily.
Some of them come in and go, something's different here. I don't know what it is, but something's really different and I like it.
A lot of physicians feel they're overworked. They have too many patients to take care of and can only do so much in a given day. But we want them to know that there are other people who can help us, like population-based medicine.
But we need to start looking at doing things differently. We need to look at our processes and look at the care of the patient. And it doesn't necessarily have to be in the one-on-one physician visit.
We didn't add additional resources. We just looked at what we were doing and how we could do it better.
Think of yourself in the middle of a circle and your support team is surrounding you. And with that, we're helping you manage your panel, manage your practice, and therefore making you stronger and better as a doctor with all your support teams around you.